Governor Doug Ducey issued several new executive orders, including boosting the number of licensed nurses at assisted living facilities.
So Governor Ducey joining us in studio with an update this week. Of course, we are also practicing social distancing. Governor, good morning to you.
Good morning.
We know you're so busy, so thank you for coming by to tell Arizonans about the very latest. One of the things you're working with U of Arizona to get all these antibody testing kits out there. That could be a real game changer.
It can be a real game changer. And right now in Arizona, it's so far so good. I want to thank our citizens. They've done a lot to slow the spread by their responsible behavior. This stay home, stay healthy, stay connected directive is working very well. And now we're focusing on what's next. Now, public health is still top of mind. It's stopping COVID-19. But Dr. Bobby Robbins of University of Arizona is a medical doctor himself. He ran the Texas Medical Institute, the largest medical institute in the world. And he's got an antibody testing so you can tell if you had COVID-19 and you recovered. You and I were talking earlier. My wife was sick in late January, early February. So was my middle son, Joe, and my mom was very sick. They all may have had COVID-19. They're all now recovered. That would be good information for them to know as to how they re-enter what's next in this dilemma.
Let me ask you, Governor, because there's a lot of talk about reopening on a federal level, on a state level as well. Everybody wants the same thing. We want to get back to business as usual. However, how do we have that conversation when here in the state of Arizona, we still don't have the proper testing to truly know how many people are infected and how the spread is happening?
So in Arizona, we've had 45,000 plus tests, and we need a lot more. Now, those tests are the diagnostic tests. They tell you if you have COVID-19 today. You could take that test and be clear today and walk out of the studio and contract it by touching a surface. That's why the testing, not only diagnostic but antibody, are important to this. So the thought is about the reopening. Of course we want that, but we want to do it in a safe and healthy way. The federal guidance runs through April 30th. We'll have a clearer sight line as to what the situation is in Arizona, and that's my top concern. I mean, other states are going to do other things on a different timeline. We're going to do what's right for Arizona at the right time.
Just to follow up on that, we have 45,000 people who have been tested. There's 7.2 million people here in the state of Arizona. We're still hearing about a lot of people who are being turned away, and these are almost the most severe cases who are actually being tested. What's going on with testing? How do we continue to ramp that up? And what do we tell these folks who are being turned away?
Well, this is an acquisition game that we're attacking in Arizona. We are ramping up testing every day. We're working with our federal partners. We're also working with the private sector. Sonora Labs, TGen, Mayo Clinic are all helping. Walgreens is going to be opening up sites in northern Arizona and central Arizona. We're only one of 7 states that's going to have 2 drive-through testing centers in Arizona. So you're talking about 7.2 million people. I imagine everyone would like to be tested. We're prioritizing doctors, nurses, emergency medical responders, correctional officers, and of course people that are symptomatic. But even if you test positive for COVID-19, the diagnosis is the same. You need to stay at home, you need to rest, and what we want to do is if you need that hospital capacity, that you've got the ventilator, you've got the ICU bed, if that's necessary. But that's only in the most extreme cases, and they've been very limited in Arizona.
How are you going to know when to open things back up? I mean, are you looking for a specific number? Is the numbers going down, less people dying? What are you going to be looking at?
Well, the first thing we want to look at, Scott, is do we have capacity to care for people? The virus is here, so it can't be stopped. It's in all 15 counties. It's in all 50 states. It's in 100 countries around the world. It's how do we deal with the situation and in a healthy and safe way get back to normal. So it's not like turning a light switch off and then flipping it back on. It's more like pumping additional oxygen into the economy. So much of that oxygen has been pulled out. What can we safely put back into the economy, and when can we do it?
We know businesses are really hurting because of this, and you've been sending out letters to business leaders across the state so you can all work together on what you'll do to get the economy to recover. What are they telling you so far, and do you think that we can get back to where we were?
Oh, there's no doubt in my mind we can get back to where we were. And I actually think we'll get back there stronger and better. It is going to take some time. Business owners, just like Arizonans, they've been responsible. They haven't wanted to shut down. None of those decisions have been easy, but I know that they were the right decisions for Arizona. Business leaders joined with me in some of these difficult decisions, and I want all of us to do this in the right way. We don't want it to be willy-nilly. We don't want to rush it. It's been very painful to get where we are today, but we've got it under control in Arizona. So to go back in the other direction and to do it incrementally and in stages, looking at rural areas and urban areas, our different populations, where we have the different spread, and making the right decision at the right time for what's best for Arizona.
Obviously, we want to give people hope and let them know that we're all going to get through this together. However, with the talk of reopening, a lot of people out there are thinking that we've already gone through the woods and we're past it and we're to the other side of the tunnel and not taking this as seriously as they did 2 weeks ago. What's your message to them?
Well, we're still in the woods. There is a light at the end of the tunnel. I don't think there's anything wrong with being hopeful, optimistic, and aspirational. That's where I am today. But I'm asking all of Arizona to still be cautious, be vigilant. That virus is out there. There still is that stay-at-home order, so you can go out and hike and do these things where you socially distance, but be smart, be responsible, and take care of yourself and your family. Wash your hands, cover your cough, all those things that have helped us to reduce the spread and to have this in a manageable position today in Arizona.
Well, we are excited for the end of the month, and hopefully we can go in a different direction at that point. But Governor, thank you for your time. You continue to stay healthy, and we'll get through this.
Thank you. Thanks, Scott. Thanks, Javier.